Good evening, ladies and gentlemen. It is my pleasure once again to be meeting all of you, and I welcome all of you in this lecture series entitled Life After Cardiac Event. This is the first of this lecture series. The title of this lecture is Your Cardiovascular Health is a National Wealth. Yes, indeed. I said this approximately 3 years back on NDTV interview, and I reiterate that today. I was asked a few queries during that interview, and I was also asked the basis for this statement. But unfortunately, because of lack of time, I could not answer it. But today is a great opportunity that I am once again back with you, and I will answer that in a very scientific way, giving you the epidemiological data of how heart diseases of various types are making a big impact on health economy and our budgetary spendings in this sector. When you talk about cardiovascular health and cardiovascular problems, there are four things which come to our mind, and these are patients who have cardiovascular problems either will have acute myocardial infarction or heart attack, or sudden cardiac deaths because of variety of factors, of which the most important is a cardiovascular problem, a heart failure, and stroke. Ischemic heart disease, in I talk about ischemic heart disease in India, I'm essentially talking about heart attack and heart attack-like conditions, conditions requiring angioplasty, conditions requiring bypass surgery, etc. Let us look at some of the figures. From 1990 until 2016, using all the available data sources that we could, the contribution of cardiovascular diseases to total deaths and the disease burden in India has doubled in the last 25 years. Ischemic heart disease was the leading individual cause of disease burden in India, and the stroke was the fifth leading cause. This is very disheartening because we were known for the infectious diseases. Of course, it is a good thing that we have been able to conquer over infectious diseases to a great extent. Unfortunately, lifestyle diseases related problems are on the increase. 50% of the heart attacks in Indians occur under the age of 50 years, which is very frightening. And what is also more frightening is that 25% of the heart attacks in Indians occur under the age of 40 years. Now, the age standardized prevalence of ischemic heart disease since 1990 was higher in the low and lower middle ETL, which is the epidemiological transition level. Now, what is this epidemiological transition level? It is the study of a population which undergoes a transition in terms of variety of factors. Here we are talking about the epidemiological transition in our country. More than half of the total cardiovascular disease deaths in India in 2016 were in people younger than 70 years. This proportion was highest in the low ETL state group, which is a major cause of concern with respect to the challenges posed over the health system, especially in the states which are underprivileged or underdeveloped. Reducing premature deaths from cardiovascular diseases in the economically productive age groups definitely requires an urgent action across all the states and should ideally be taken at the central level. And I'm glad that such things are coming up. I'm going to talk about some of the policies that were declared by our Prime Minister this morning in the speech. The second important issue is the silent heart attack. We know that heart attack occurs with lot of symptoms like chest discomfort, chest tightness, chest pain, diaphoresis, which is sweating, loss of consciousness or dizzy feeling, etc. But you will be surprised that a lot of heart attacks are silent heart attacks. And in fact, silent heart attacks account for almost 45% of all heart attacks in some of the studies. Based on the analysis, adults with evidence of silent heart attacks have in fact, very unfortunate to know, that they have a 34% greater risk of death. than the symptomatic heart attacks. Silent heart attacks are more common in men than in women, and silent heart attacks are associated with a greater risk of death in women. Silent heart attacks are also quite common in the middle-aged group. The third important cardiovascular problem is the heart failure. Here I want to reiterate and want to tell all of you that in heart failure, heart attack, and cardiac arrest. Unfortunately, a lot of people think that these are synonymous. No, that is not the case. A heart failure is more of a chronic condition in which the heart does not pump blood at a rate which is commensurate with the metabolizing tissues. And this is because the heart muscle has become weak, and what we all know, ejection fraction has become low. A heart attack means a damage to the heart muscle due to block in the heart artery which is supplying the blood to this functioning heart muscle. Of course, if it is large and if there is a complete waste and loss of heart muscle due to this, then it could lead to heart failure, but these are not synonymous. Likewise, cardiac arrest means a condition where heart suddenly comes to a standstill. According to a study published in the National Medical Journal of India in 2010, which is almost 10 years back, the estimated prevalence of heart failure due to variety of factors like coronary artery disease, as I mentioned, hypertension, one of the most important causes of heart failure in our country, obesity by way of various mechanisms which I'm not going to discuss today, diabetes, a very, very important cause of not only blocks in the heart arteries, but also with normal heart arteries, you can have heart failure, and rheumatic heart disease, which is a very, very important cause of heart failure in our country. This ranged from 1.3 million to 4.6 million, with an annual incidence of almost 500,000 to 1.8 million patients. However, these did not account for the other important causes of heart failure, and which are very relevant and very, very important in our country: abuse of alcohol, cardiomyopathies of variety of reasons, including some of the viral induced cardiomyopathies, pericardial diseases, and endomyocardial fibrosis, which can all lead to heart failure and increase the burden of cardiovascular problem. And these are very specific to the Indian subcontinent. Apart from a previous history of coronary artery disease, patients who have hypertension, obesity, diabetes, or those with congenital heart diseases also are at a higher risk of suffering from heart failure. As I said some time back, diabetes is an important health which is definitely associated with an abnormal or not so good lifestyle, is affecting a lot of our population. There are at least 51 million diabetics in our country, which sometimes is the population of entire country. This is the highest ever reported number from anywhere in the world according to the International Diabetes Federation, and Indians unfortunately tend to acquire diabetes at a much younger age as compared to the Westerners, almost younger by 10 years. Sedentary lifestyle is a major cause of death, disease, and disability. And the point that I want to stress here is that a lot of these diseases which I have just mentioned are related to the lifestyle. So it's very, very important that if you don't want to stress yourself in terms of your health, in terms of your pocket, because you will end up spending a lot of money ultimately correcting these problems, it is better that you improve your lifestyle today. Physical inactivity increases all causes of mortality, doubles the risk of cardiovascular disease and type 2 diabetes and obesity. With increasing incidence of diabetes and hypertension, there is an increased incidence of coronary artery disease. The sudden cardiac death. What is sudden cardiac death? I'm sure you must have come across some incidences in your life. You must have heard a few things that a person had discomfort in the chest, and before he could go to the hospital, he was dead. A sudden cardiac death is defined as a death which occurs within 1 hour of onset of symptoms. What is frightening and worth taking the cognizance of is that almost 25 to 30% of sudden cardiac deaths in the age group are occur under the age of 40 years. The mortality of myocardial infarction showed that 60% of the deaths that occurred out of hospital were sudden, which means hospital-based treatment of myocardial infarction, which you all know, is a high-tech primary angioplasty would prevent, unfortunately, only a small proportion of deaths related to myocardial infarction. And therefore, prevention here is much, much better and makes a huge deal of impact on everything. Time to treatment is critical when considering the chance of survival for an SCD victim. 95% of those who experience sudden cardiac death die because they do not receive life-saving defibrillation. What is this defibrillation? I think that's a separate topic, and we will be dealing with these things in the series that is being done at this juncture. But you must have seen this in movies that when a person is about to die or just about to live, receives a shock from outside by placing two pedals on the chest. This is called as defibrillation. And if this is not given within 4 to 6 minutes, the person may be dead in terms of brain and other activities. The majority of sudden cardiac death events occur at home, and unfortunately, what is horrifying is that there is a witness to this sudden cardiac death in 85% of the cases, which means somebody was there around the person who died, realized that there was something horrible happening, but had no means or had no knowledge of how to prevent this. Only 5.4% of the patients were brought to the hospital. Unfortunately, large majority being brought to the hospital in public vehicles or hired vehicles, which are not geared up for this kind of an emergency, and it is impossible to save a life when the person is brought to the hospital in such transport methods. The lack of mention of any form of resuscitation in all the deaths analyzed was therefore very, very striking. The majority of cardiac death events occurred at home, and as I said, were witnessed in 85% of cases. At least one of three CAD risk factors were present in the victims. Mind you, once again, we are talking about the risk factors of hypertension, which to a great extent is preventable. Diabetes, of course, once again, to a great extent is preventable or is at least deferrable, and smoking, which definitely is preventable. So at least one out of these three CAD risk factors were present in 81% of people who died of sudden cardiac death. What is the economic burden of cardiovascular disease? The review of cardiovascular epidemiological studies in India indicates that this has become an important public health problem, and CHD, that is one of the most important cause of mortality and morbidity in our country. It therefore leads to a massive economic burden. It has been determined that return on investment of interventions to promote healthy living and to prevent, treat and manage these diseases is very, very cost effective. 1 in 4 deaths in India are now because of cardiovascular diseases, with ischemic heart disease and stroke responsible for more than 80% of this burden. These diseases tend to affect patients, unfortunately, in the most productive years of their lives, as we have already seen, and this results in a very catastrophic social and economic consequences. The increasing burden of cardiovascular diseases and its risk factors needs to be addressed, therefore, very, very urgently and on priority. Although there have been impressive advances in the capacity for preventing and treating cardiovascular disease globally, these need much enhancement across all of India, with particular attention to the relatively less developed states, where the rate of increase in the cardiovascular disease burden is among the highest in the country. Once again, reiterating that cardiovascular disease is a major cause of disability and premature death throughout the world, and it substantially contributes to the escalating costs of healthcare, mortality, and morbidity. You'll be surprised to know that every 42 seconds, one person is dying of a heart related problems or blood vessel related problem. Deaths due to cardiovascular disease in the working age group, which we consider as the most productive age group from 25 to 64 years, resulted in 9.2 million potentially productive years of life being lost in the year 2000. What does it mean? Which means if you have 2 million patients of heart attack, if you have 1 million patients of heart failure, if you have another 500,000 patients of sudden cardiac death occurring in the most productive age, and if you add up man hours, if you add up the absentee of these individuals from their workplace, the productivity is lost. This translates into a significant loss of man hours. And this, unfortunately, is expected to increase to a loss of almost 18 million years by 2030. And therefore, it is time, guys, that we think that all these problems are just not pertaining to yourself, are not just pertaining to your family and to people in your vicinity, but they are ultimately going to make an impact on the health budgets and on the economy of our country. Reasons for the high propensity to develop CVD, the high case fatality, and the high premature mortality include biological mechanisms and social determinants. Of course, I am not going to be discussing these biological mechanisms and this in detail. Addressing this significant burden requires an understanding of both the biological as well as social determinants, which of course will be the job of policymakers, politicians, bureaucrats, and of course epidemiologists. The World Health Organization has estimated that with the current burden of cardiovascular disease, India would lose $237 billion from the loss of productivity and spending on healthcare over the next 10-year period. Now, for those who understand 1 billion is equivalent to close to 7,500 crores. You can multiply this and get an approximate figure of what would be a total loss of productivity in the next 10 years. I would want you to have a look at this particular chart, which shows how much was the expenditure which was either out of pocket or otherwise amongst people who were very, very poor, rich, and some of the richest. Unfortunately, the discrepancy between what the poorest spent and what the richest spent on their health problems was not much. Whereas we know that in terms of their affluency of economics, there is a humongous difference. This means that poorest and poor were affected more because if they developed health related problems, they were unfortunately shelling out hell of a lot of money in comparison to their income. Of course, with the newer policies coming up, with the Jeevandai schemes coming up, and with some of the reformed health structure changes which are coming up, this difference is likely to be negated. Let us look at this chart of how much India is spending on the healthcare sector. If you look at the bottom of the chart, India is approximately spending $93 billion as against a lot of countries which are much smaller in size, which are probably not as affluent as our country, but yet they are spending huge budgets. Ability of a nation to spend more on healthcare also indicates that it's a welfare state. But mind you, the point that I'm trying to make is completely different. If you can save by way of preventive measures, the expenditure on this sector you are probably going to be able to divert all this money towards development of infra, development of other areas which are of utmost importance today in Indian economy. In which case, what are the steps that we must take for prevention? Prevention is discussed under three headings: the primordial prevention, the primary prevention, and the secondary prevention. The primordial strategy is prevention even before a risk factor develops. And for that, you have to do something which is very simple: avoid smoking, avoid abuse of tobacco and alcohol, or complete cessation, a good physical activity, a very, very healthy diet, so that you do not develop risk factors at all. Because if you develop risk factor, then you are likely to have an event, and then we move from primordial prevention to what is called as the primary prevention. A primary prevention should focus on screening and better control of risk factors like hypertension, hypercholesterolemia, and diabetes, and to prevent incidence of overt cardiovascular disease. Once the event has occurred, which is the secondary prevention, a good quality secondary prevention and better management of acute and chronic events will prevent premature mortality and morbidity. To summarize some of the important points, the global burden of disease estimate of age standardized cardiovascular death rate of 272 deaths per 1 lakh population in India, which is much higher than the global average of 235 per 1 lakh. Some aspects of the cardiovascular disease epidemic in India are particularly of big concern, and these are: there is an accelerated buildup of these problems and early age of disease onset in the population, unfortunately affecting our one of the most productive age groups, and the high case fatality rate. In India, the epidemiological transition from predominantly infectious disease conditions to non-communicable disease has occurred over a very brief period of time. In India, more than 17 lakh people die every year due to heart diseases, and by 2030, the figure is expected to increase with 2.3 crore deaths. Now, this is the age distribution of our population. It is of interest to see that we have almost less. If you look at this particular chart, you will realize that below the age of 45 years, we have a population which is almost 80%. Below the age of 59, we have 90% of our population, which is very heartwarming, because this only indicates that most of our population at this juncture is in the most efficient or productive age group. India has more than 50% of its population below the age of 25 and more than 65% below the age of 35. It is expected that in 2020, the average age of an Indian will be 29 years, which is the case today. And once again, it is very nice to see that most of our population is going to be in a very, very productive age. And we can expect a lot of reform and a lot of efficiency from this group, which forms a chunk of our population. As compared to China, it is 37, and in Japan, it is 48. By 2020, India's dependency ratio should be just over 0.4. Now, what is this dependency ratio? It is the ratio of people who are unemployed or who are not productive to people who are actually employed and are productive. A ratio which is definitely more than 0.8 is not very good. A ratio more than 1 is definitely not acceptable. And By 2030, which is in next 10 years, our dependency ratio will be around zero point 0.4, which is very, very heartwarming thing to hear today. But once again, as I mentioned in my brief video before this particular lecture series, I had mentioned about the complacency. Complacency is going to take a toll. So let's not be complacent about this figure, and let's work towards more efficiency and more productivity. The life expectancy of an average Indian man is 68 years, and that of an average Indian woman is 70 years. What are the central government health policies? The World Health Organization Essential Medical or Medicine List, which is the EML, was first published in year 1977. This list over a period of time has grown to more than 400 medications and has now been adopted by many countries. India adopted its own NLE approximately in 1996. Since its implementation, India's NLEM has been expanded to include not just medicines but a lot of medical devices and procedures, which was very, very good. And one such example is the unprecedented decision to add stents to an NLEM in 2017, thus enabling price capping of the stents. Historically, stents were subject to substantial price markups by intermediate distributors and were in some cases even 4 to 5 times greater than the original value. The decision to add stents to these NLEM resulted in a price reduction of up to 85%, and I feel that there is still some scope. Like medications, diagnostic tests are also crucial in improving healthcare delivery. The WHO EDL, or the Essential Diagnostics, it is intended to set a reference for the development and update of national EDLs adopted at the higher level. Given the growing burden of CVDs in country, CVD related diagnostic on the draft Indian LAD, as well as highlighted additional diagnostic tests that should be considered in the diagnosis and management of CVDs, have been advised. To identify which tests should be priorities for CVDs, the top conditions in India ranked by disability adjusted life years were selected, and these include ischemic heart disease, cerebrovascular diseases, rheumatic heart disease, cardiomyopathies, myocarditis, atrial fibrillation flutter, aortic aneurysms, and peripheral vascular diseases, along with endocarditis. Today morning, an address by our Prime Minister, and it was very, very heartwarming to hear that there will be a unique digital ID, which will be a health ID created for every individual like Aadhaar card, which will probably store the entire life history in terms of health problems of that particular individual on the card. The National Digital Health Mission was also declared by Mr. Prime Minister this morning. And this comes under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. According to the central government, the NDHM will improve the efficiency, the effectiveness, and the transparency of the health sector even further. In India, as it will allow people to access health services remotely from wherever they are, get teleconsultations, and get prescribed medications at a much cheaper rate. With this, I only want to reiterate finally that it is very, very crucial that you maintain your heart pretty well, you maintain your healthy heart extremely well by way of looking into your own risk factor profiles, by looking at your lifestyle, by looking at your genetics, and this will transform into a much better quality of life, not just for yourself, but it will prevent you from having some economic damages which are absolutely not thought of by us Indians, and it will ultimately translate into a better economy by putting less burden on the health budgets that are spent by the state as well as the center. I wish all of you a very heart healthy life. This has been an initiative by Hardas Heart Foundation with my latest videos and cardiology related important tips, tricks, and likes. Please follow Hardas Heart Care official Facebook and Instagram page. If you are watching this video on YouTube, please make sure to subscribe to this channel and click on the notification bell so that next time when I come back with some new video, some new information which I would like to share with you, you will be notified. Thanks a lot for your love and support. Jai Hind. Namaskar.